Will democracy survive the next couple of years?
Access to Democracy is made possible by donations from the following organizations. Thomson Reuters, a global company with expertise and insight to unravel complex situations in the areas of law, tax, compliance, government, and media. Their worldwide network of journalists and editors keep customers up to speed on relevant global events. Thomson Reuters, The Answer Company. Crutchfield Dermatology, a full-service treatment center and Medi-Spa in Eagan. Their goal is to help you look good and feel great with beautiful skin. With service built around courtesy, dignity, and respect, Mayo-trained Dr. Charles Crutchfield personally treats each patient and is acknowledged as one of the nation's best physicians. Truestone Financial, with locations in Minnesota and Wisconsin, has proudly served its members since 1939. Truestone engages, educates, and supports its members to ensure they have the tools to empower their financial well-being. Truestone Financial, your neighborhood credit union. Learn more at truestone.org. Edina Eye Physicians and Surgeons, a division of Twin Cities Eye Consultants, has proudly served the Twin Cities for more than 55 years now, in 7 convenient locations. Using the most advanced technology combined with human touch, Edina Eye offers comprehensive services and dedicated specialists committed to excellence, with innovative procedures and expertise for the most advanced eye care.
Welcome back to Access to Democracy. Alan Miller with you. And, people generally gravitate to the Twin Cities from other areas and other states. Today's guest is a fellow who escaped the Twin Cities to go to Iowa. Now, Lord knows why anybody would want to do that, but we'll ask Dr. Dan Whitney, who is a veterinarian, and welcome to Access to Democracy again, Dan, because you were on once before. Years ago.
Thanks, Alan. Thanks for having me. I really enjoy being here with you.
Now, Jordan Creek Animal Hospital is located where in Iowa?
Now, we're in West Des Moines, Iowa, so just central and just outside of the downtown Des Moines metro area.
And where did you go to school?
I went to Iowa State University. So actually my time up in Minnesota was brought on by my wife. She took me up there for a few years, and somehow I convinced her to come back to Iowa after we were up there for a little while.
She a Minnesotan?
She is. Yep. She's from the Minnetonka area.
Okay. Well, there had to be a reason that you would leave, and you were here at Eagan Pet Clinic for a number of years. I don't know how many. I know you treated certainly Katie, among others. But why would you? How many years were you there with Eagan?
I was there just around 4 years. I was up there for. And so, my wife took us up there in the first place. We moved up there to be closer to family. And as you said, landed at Eagan Pet Clinic was just the perfect place for me to land. Just a great place. And we toyed with the decision a little bit on whether or not we stayed up there, but the hospital I'm at now and currently a partner at is my dad's practice that he started up when I was a young kid. So
there's a reason. There's a family reason.
That's exactly right.
Back to.
That's exactly right. So
and you are now partners with him and
yep. So I have
Creek Animal Hospital.
Yep. Have the opportunity to work alongside him, and now thankfully, buy into the practice and own it alongside him too. So it's been a kind of a lifelong dream come true for both of us that we get to do it together.
Now, I assumed that because you're in Iowa, that you treat horses, snakes, and everything else, and you advised me that you only do dogs and cats.
Just dogs and cats. Yeah, most people that walk through the door, I don't think they'd want me treating much else than dogs and cats at this point. Most of that knowledge is kind of left me at this point. But yeah, we We're a bigger metro area down here, I think, than some people up in the Minnesota area might think. But there are definitely a lot of large animal veterinarians down here. But we tend to gravitate towards one specialty if we're in kind of a bigger city area like we are.
Well, I know one thing that's very difficult to come by is veterinarian orthopedic doctors, because I just had that experience. In fact, I even called you and asked you if you did operations down there when Katie tore a ligament and needed surgery. And the backup here was 6 to 8 weeks. And I guess your situation was no better. Is that true?
Yeah, unfortunately, it hasn't been. It's been as it has been for everybody. The last year and a half has really slowed us down quite a bit. Not only do we have short supply of access to specialists like orthopedic surgeons in the first place, but now everybody's been backlogged with COVID, just as the amount of patients that we can get in. So it has been tough. Getting appointments sometimes for patients when we want to has been a difficult thing lately.
Well, how did COVID impact you?
It's changed how we practice quite a bit in the last year and a half, and we're starting to get back towards a little bit of normal. But as I'm sure you experienced with Katie up there, you probably weren't going into the veterinary clinic inside the building, for the last year and a half to actually see anybody face to face.
True. Pull up in the driveway,
Right.
call in, give a honk, and then somebody comes out and gets your animal.
Right.
Which is not.
And so we were
really
fortunate.
good.
We never had to close our doors. Yeah, it definitely presented some challenges, and we were fortunate. We never had to close our doors here, but to try and keep our staff as safe as we could and try and keep our clients as safe as we could too, that's exactly what we did. We're able to see the patient still in the building without necessarily having to have the client, standing across the table from us.
It had to be kind of difficult for you though, because you're pretty much a hands-on
Yeah.
veterinarian, and your hands are on the clients and not on the patients necessarily.
It was challenging. I like that face-to-face interaction, and we tried to find different ways to make it work, either through video chatting or just being on the phone with them while we're doing it. But it definitely was different for us, and a lot more kind of boiled down to that communication that you had with the owner, since they didn't actually get to see everything that we're doing when we're performing the exam. So it was challenging for sure.
Now, do you do simple operations there, or?
Yeah. Yep.
Yeah.
So we are technically, we call ourselves a hospital. We do surgical procedures. We do some hospitalization, although that's getting more and more challenging as we don't have somebody here 24/7 to be with a hospitalized patient if that happens. Most of our procedures we do similar to Eagan Pet Clinic up there, in that we'll do dentistry procedures and a lot of soft tissue procedures like taking off growths, doing spays, doing neuters, and the occasional abdominal procedures. Think if your dog ate a sock and we need to get it out of there, things like that come up. But we don't do very much orthopedically like Katie needed. A lot of times we refer those off to specialists for better care.
How long was the wait, or how long has it been during the COVID?
It's been anywhere from getting people in about a month to getting people in 2 or 3 months. I had one earlier that needed the same procedure that Katie needed, and I think we called the university in town here in May, and they weren't able to get them in until mid-August or late August at the time. So it has been a challenge for us down here too.
Yeah, we had the same. I called the Minnesota Veterinary Hospital, and up from the U, and we had the same thing. We couldn't even get her an appointment for 2 months, without even setting up an appointment for an operation. So it's been very difficult.
It has. It's proven to be a challenge, but hopefully it seems to be getting a little bit better now, where less and less restrictions inside the hospitals seem to be opening things up, or at least allowing some hospitals to be a little more efficient. We're learning how to deal with the situation that we're in so that we can be more efficient and get more cases through.
Now, you left Minnesota with 1.5 children, and I understand you're up to 3.
Yeah, I am. Yep.
Is it the air in Iowa or what?
Yeah. I don't know. Some days we kind of wonder what we got ourselves into, but they're a bundle of fun, and they keep me grounded when I'm not at work, and keep me sane when I'm not at work too. I have a tendency to work a little too hard, as my wife would put it. But when I get home, it's fun to get to let loose with them.
Ages and sex of the kids are?
Yeah, my two oldest are girls, and they're 5. They just turned 5 and 3 this summer, and my youngest is a little boy, and he's 9 months old.
And I guess your parents are very happy to have you there.
Oh yeah, yep,
Certainly your
yep.
mother, especially.
As much as my dad likes practicing with me and enjoys that part of things, I think
Yeah.
I'm pretty small in comparison to having the grandkids back in town, being close.
Is there just the two of you in the hospital, or do you have other doctors there as well?
We have other doctors as well. So currently we've got 6 doctors, including myself, that work on a regular basis. And then we've got a couple of relief doctors as well that will come in. And well, we're kind of blessed in the fact the couple of relief doctors we have are actually veterinarians that worked for us in the past that have decided they wanted to cut their hours back quite a bit. And so they come in to help out when we need them.
That's a big operation.
It is. Most of us, though, aren't working full weeks as well. So we're probably close to having about 3 full-time doctors here overall, as far as the staff equivalency goes.
And what is the size of the area that you draw from?
Area here, I guess I don't have the exact numbers. The Des Moines metro area as a whole is close to around 600,000 as far as the population base goes, and it's growing tremendously. West Des Moines has always been a pretty fast growing suburb, and just farther out west from us is Waukee, and they're one of the fastest growing suburbs in the country. And so there's people flocking here all the time. Maybe not from Minnesota, but people coming here all the time. So
I was going to ask why.
Yeah, right. We may not have the lakes, but I think the biggest thing for us down here is we've got nice communities, and it's a great place to raise a family. It really is. School systems are great down here, and I like to think that the veterinarians are pretty good down here too. So
you got a lot of competition veterinarian wise?
We do. Yeah, it's one of the denser populations for veterinary medicine, probably because of the university is close to us, where I went to school, and outside of the Des Moines area, good majority of Iowa is pretty rural. So anybody that wants to go into, live in a suburban or city population, a lot of them are looking in this area once they get out of school.
And what's the crime situation?
It's pretty good, especially outside of the city center as well. But yeah, overall, we feel very comfortable here. I always revert back to
difference. It really does.
Some of my family is not very good about ever locking their doors, even when they're not at home, just because we never really think about it as an issue. So
you shouldn't broadcast that.
Yeah, right.
So veterinarian practice as a future for you or for somebody else, what would you say about it?
It takes the right person to want to go into it. It's a very fun job. It's a very rewarding job, but it's challenging as well. And probably the biggest challenges that I think most people aren't aware of when they're looking into it is you get a lot of younger kids that say, yeah, I want to be a veterinarian when they grow up, and they don't necessarily understand what that means as far as what you have to go through schooling wise. And probably one of the biggest challenges right now is the cost that it takes to get through schooling compared to what you can actually make when you get out of school. Veterinarians that are going through school right now, in some aspects, are going through just as much schooling as some doctors, and they're coming out on the other end, and their debt ratio to what they're making is poor. So it can be challenging, and it can be stressful that way. But for people that really like it and want to do it, it is very rewarding. I enjoy every day. Every day is different. And I get to interact with animals, which I love, but I also get to interact with people every single day. And I love that as well. And it keeps me coming back for more. So
You have your own dog at the moment, or dogs?
I do, just one dog. My wife claims she's allergic to cats, so I don't know if that's ever in the cards for me. But we do have a dog at home. His name is Freddie, and he's a little. He looks like a miniature black lab, but he's a mix of a number of different breeds.
A rescue?
Yep. He was. We got him when we were up in Minnesota, so he's Minnesota born as well.
Now, talk about getting rescue dogs. I know during the pandemic, the shelters were just about cleaned out of dogs and cats. And as a matter of fact, there are a lot of cats that suddenly have come on the market where people gave them up, which is tough to understand. I haven't heard that about dogs. But talk about shelters and rescues and the pandemic.
Yeah. There's been concern there as well for dogs. Thankfully, we're a little bit isolated here. We haven't had a lot of the potential negative consequences of everything that happened with COVID that way. But, really towards the onset of COVID and everybody spending more time at home, we had an influx of a lot of people bringing in new pets. People looking for companionship or, having somebody at home with them at the time. And you're right. A lot of shelters have found a lot of homes for a lot of pets. And the concern now is that now that everybody's going back to work, we're going to start dealing with more behavioral issues like separation anxiety, or people that just don't feel like they can harbor the responsibilities to take care of them anymore. And thankfully I have not personally had to run across a lot of that here, but it may just be timing. We may be noticing it more as the fall comes around and more people go back to work.
Well, what do you do for a dog who's going through separation anxiety? Do you have dog psychiatrists around?
Yeah, right. Well, in a different term, yes, we do to a certain degree. But if you think orthopedic medicine is hard to get into, behavioral medicine's even worse. There's probably less than 30 of them in the entire country. So that's a hard specialty to get a hold of anybody into. But we use, local trainers in the area, people that aren't necessarily veterinarians, but have training experience, try and help out. And a lot of it's environmental, what we try and do to manage the environment at home for them to make it, even if somebody is going back to work, how do we change things to make it more appropriate for the dog and help them through it? And medications are involved sometimes as well to try and help them out.
Now, these animal shrinks, do they have very low couches?
Yeah. Oh, that's good. I'll have to get a picture of somebody's setup at some point, but that I would enjoy that if somebody actually had a nice little couch for the dogs to lay on there in there.
Well, it is a problem, and it's something you have to consider. Even Katie, with being around the two of us and us being around her a lot more because we didn't go out during the pandemic, has taken to becoming a whiner when she's alone. And even if we're both, say, outside or something like that at the same time, as happened earlier today, she let us know that she was not happy about it.
Yeah. Yep. So it's challenging. Behavioral changes are one of the bigger things that we have to deal with as well on a day-to-day basis. It doesn't get a lot of the limelight as far as disease processes go, and they can be challenging ones to deal with. But we do deal with a lot of behavior on a day-to-day basis.
No, I'm with your wife when it comes to cats, and I have definitely had allergies to cats. Although Sharon years ago had cats, but do you prefer working with dogs or cats?
You know what? Pros and cons to both sides of things. I think I'm more accustomed to working with dogs just from a standpoint that I see more day to day, but I like working with both of them. There are some doctors out there that specialize in just feline medicine. They only see cats. And I don't know there's too many people out there that see only dogs, but I'm sure there are some. I don't know that I could go one way or the other though, because I enjoy getting to see both of them. A little bit different style of medicine, different handling and behaviors, everything that way. But I enjoy both aspects.
Dogs don't have to get COVID shots though.
No, not at this point. So I think that we actually just talked about that in a staff meeting today. And the American Veterinary Medical Association just came out with a new report saying, most of the studies indicate that our dogs and cats can pick it up if they're in close contact with people that have it, but they generally have very mild disease and they clear it very quickly as well. So it has not been something that's been an issue for us as far as needing to treat anybody or doing any, worrying about vaccines or anything that way.
Can they be spreaders during that period?
There's not any evidence to suggest that they are. So it appears like they carry it when the people do, and then they clear it when it's gone.
Now, the Humane Society tries to keep all animals alive. Is it possible? Do you have certainly institutions there that try to keep them alive as opposed to putting them down?
We do. It just depends on the organization. Unfortunately, there are some that can't, and then there's others that are what they call themselves as no-kill shelters, where there's they find by any means possible not having to go the route of euthanasia for unwanted pets and animals. But we have both in the area here, unfortunately, and it is. I mean, right now it hasn't been as much of an issue given how many people want new pets and animals, but as I'm sure you guys are aware up there, there's just a constant influx of new animals, and especially where we are in kind of the northern Midwest climates, a lot of them are coming from outside areas. I know Minnesota, when I was up there, a lot of animals were coming from the Oklahoma, Tennessee, southeastern areas.
Even Mexico.
Even Mexico, yeah. We had one. I haven't had that here, but up in Minnesota, we did have somebody that was importing dogs in from Mexico. Got to see some different things from some of the dogs that were coming in from Mexico. But
do you speak Spanish?
No, I do not. I do not.
That's very difficult for the dog if you don't.
Yeah, right. So they're coming from all over the place. There's a lot of them, unfortunately.
What's the advisability of when you get an animal, putting a chip in it for identification purposes?
We do it routinely down here, and we recommend it typically for all of our dogs that come to us. It essentially, we've got a little microchip, as we call them, that we can implant underneath the skin, and that allows a device or a reader to actually pick that chip up, and it gives you a number. It's kind of like a tag that can never fall off, right? So if your dog's collar ever gets off, your cat's collar ever gets off, and they're found outside, somebody can identify them still and find where they need to go. So we like them quite a bit. The majority of our clients have them down here, and a lot of times we'll do them when we'll put those microchips in when they're under anesthesia for their spay or their neuter, so that they're in place and ready to go.
Would you say that in terms of home life property, you have more property down there than we would have in the Twin Cities or the suburbs?
I think it's relatively on par. It's just that your guys' metropolitan area is just a little more spread out. It just kind of, like for us down here, depends on how close you are to the downtown area. So yes, on the outskirts here, I feel like land sizes are probably a little bit bigger, but I don't know. It seems like the trend nowadays, anyways, at least down here, is that a lot of the suburban homes, the yards are getting smaller and smaller, and maybe people don't like to take care of the yards quite as much.
We're finding that also, and I can't imagine wanting to live in the Midwest and not wanting to have property.
Yeah, right.
Not really having, we have an acre. No, we have a little bit less than an acre, I guess.
Mm-hmm.
And I don't think that's enough.
Yeah.
Fortunately, we back on a park, so that makes it good for in terms of the dog. But,
yep.
Although it's been very difficult because she can't go up and down stairs except rarely now for 8 weeks, I guess it is.
Mm-hmm. Mm-hmm. Now she's got a little more recovery time before you feel comfortable having her go up and down the stairs just yet.
Yeah, and she refuses to even try to jump into the car or on the sofa or anything. All the things she used to do, she just won't do them. She's smart enough to know that she can, and we can't.
That's good. We've got some dogs that don't hold themselves back afterwards, and it makes it challenging for the recovery period. So I'm glad she knows what she needs to do.
Well, she reads and writes, so it's you can follow directions pretty well. Now, dogs, we are finding out more and more, have incredible capabilities. Not necessarily cats, but dogs. What are some of the They have become COVID sniffers. They've trained them now to recognize the COVID. They're used for narcotics sniffing and things like that. What do you say about the capabilities of dogs? Are they unlimited?
Well, I think there's probably some limit to what they can do, but in the grand scheme of things, it's pretty incredible what they can, and the things that they can learn, and as long as we're teaching them in the appropriate way, what they can pick up on is awesome. It's just neat to see, and a lot of dogs out there, while most of them are house dogs now, a lot of them want to work and have something that they do to keep them energized, and getting to see that is fun. And even if for some dogs that work or that mentality is just being a companion, that it's just such a neat thing that they bring into a family environment, and beyond that, what they can do if we can train them to the right things.
What do you think about training schools for animals? And I don't like to say, roll over and play dead and things like that. I mean, Katie does certain things, right paw, left paw, and things like that. But in terms of turning them into circus animals, I just don't approve of it.
Yeah, I think it depends on the means that they're going for. I do think some of those things, that some dogs enjoy doing it. And, there are some dogs where maybe we're not doing anything with them, like playing dead or rolling over. Maybe we're not doing anything that is bringing any meaningful work to what the end goal is, other than bringing everybody enjoyment. But some dogs like that. They like the stimulation. They like the, paying attention, learning, knowing what they need to do, and getting that interaction. So it's something, to kind of go back to some of those behavioral things we talked about. We go over with some people. Some of these dogs need some mental stimulation, and just sitting around the house doesn't cut it for all of them. So that can help.
Oh, I forgot to disconnect my phone, so now I just disconnected it. I was just about to get into training of dogs, and completely threw my
Oh, that's all right.
In any event, the differences between living and life in Iowa and life in the Twin Cities suburbs.
Well, we're a little bit warmer down here. That's probably one of the bigger changes. We get about 2 more weeks of spring and 2 more weeks of fall than you guys do up there, but we're windier down here. So the colds don't get as cold, but sometimes they hit a little harder with all the wind that we do get. So
we've had bizarre weather this spring. And when we've had 14 days over 90 so far. So that's a record thing for the state. And
it's been back and forth for us down here as well. But they're very similar in a lot of aspects. Not quite as not as many lakes for sure. And the outdoors life is just not quite as robust down here amongst the people. But they're very similar in a lot of ways.
We've been talking to Dr. Dan Whitney, a veterinarian who used to be a Minnesotan, and he's now down in Iowa. This program could be entitled Going to the Dogs. And Dan, thank you so much for your time and your expertise, and hope to see you again.
You're welcome,
Hope to see you in person sometime.
I know, hopefully soon. So it was a pleasure being on. Thank you for having me again.
Okay.